Hannah, how are you and the patient-led research collaborative thinking about the questions of reinfection?
Yeah, unfortunately, there's been a pretty intentional public health decision to move away from the pandemic despite there not being evidence to do that. There was just the assumption that vaccinations would be sufficient to end the pandemic, and that obviously didn't happen. I think the most important thing would probably be system-wide infrastructure change into air ventilation, clean air, like we saw for sewer systems with cholera. This is something that is not only going to be around forever, but also we are facing increased risk of future pandemics, both immediately and in the short term with the increase in climate change, which is a risk factor for pandemics. So this is just something we should be taking into consideration. I strongly believe that all public spaces should have ventilation requirements that are indoors. And until then, masking is so easy. There's become a stigma to it, but truly people who mask don't get sick, where everyone else, is constantly not only getting sick again with COVID, but because everyone's immune systems are weakened, are getting sick with everything. So it takes kind of a strength of self to mask in the face of no one else masking. It's very hard to go through the world with the knowledge I think that our community has about what COVID is doing to our bodies and our community and friends' bodies. And it's a cognitively challenging space to be in.